Well, good evening, everyone. Thank you for joining us for tonight's Ask the ARC session on busting myths. My name is Carly Shortino Poulter, and I'm the director of the ARC Advocacy Network here at the ARC of Indiana. But more importantly, I'm a fellow mom. I have a young adult son with autism, and so I live this life too. And especially when he was young and we were still learning everything. Man, it was hard to find information. And then a lot of the information you got was old or just flat out wrong, or you didn't know the right words to use to ask the questions you needed to get the answers you were looking for. And so it's really difficult. And so there are a lot of myths out there surrounding the disability world. And tonight, that's what we're going to talk about. We're going to talk about busting those myths that are out there. So let me start by sharing my screen. Uh, all right. So as I begin, I want to take a moment to make sure, um, in case you are not familiar with the ARC of Indiana, I want you to know who we are. So the ARC is an advocacy organization that was established back in 1956 by families who wanted a better life for their kids with disabilities. As simple as that sounds. But this was 1956. If you had a child with a disability, you were told to place them in an institution. You were told, don't go visit because that would be confusing and cruel. And then you were told to have another baby as soon as possible so that you wouldn't feel sad. And our parents said, forget that. I'm raising my own kid, and they're going to go to Sunday school, and they're going to play baseball, and they're going to do chores around the house just like all their brothers and sisters. And so that's how the ARC of Indiana was founded back in 1956. Today, we are one of the largest and most influential advocacy organizations for people with intellectual and developmental disabilities of all ages and their families. We do a lot of public policy work. So we work extensively with the Indiana Department of Education, the Family and Social Services Administration, and all of their sub agencies below them, the Indiana General Assembly, the governor's office, and just about anybody you can think of. And so we are committed to that progressive legislation and public policy that protects the rights of people with intellectual and disabilities and improves the services available to them. We are home of the ARC Master Trust, which is the state's largest pooled special needs trust, which is a way that you can set money aside for a person with a disability without jeopardizing any of their Medicaid or Social Security benefits. We are also the founders of the Erskine Green Training Institute, which was the first of its kind in the country. It is a residential training program where people with disabilities can learn either the hotel, restaurant, or hospital industry. They live in the hotel for either 10 or 13 weeks, depending on which programs they choose. They load up on whatever professional certifications there are, and then they go back to their home communities to get real, competitive wage, community-based jobs. But I'm also very proud to announce that we have expanded to Indianapolis. So now we have EGTI Indy. Now that's a little bit different because it is a commuter-based program. So students will actually continue to live in their own homes and commute to the program. But we've partnered with both Allison Transmission as well as Riley Hospital for Children for those programs. And then we are part of the ARC of the United States because advocacy is needed at every level. And so we are part of the ARC of the United States. In fact, we're the largest chapter of the ARC in the country, working at the national level too on making sure that laws and programs and regulations benefit people with intellectual and developmental disabilities of all ages and their families. So tonight, we're going to focus on three big categories of myths because like I said, there is a lot of misinformation out there, but there's also a lot of old information out there, and there's a lot of nuance to the things that our loved ones are involved with, and sometimes we don't get that. So tonight we're going to focus on three main categories. We're going to focus on those waiver myths. We're going to focus on transition to adulthood. And then we're also going to focus on employment. And at each section along the way, I'm going to stop to ask what myths you have heard, or what questions you have, so that we can address some of those issues as well. And then at the end, we'll also open it up in general. So if you could put your questions in the question and answer section, that would be really helpful. And we will address those as we go along. So let's get into those waiver myths. And you will hear as we go along, you will notice by some of my answers that some of these can really be my big pet peeve. Um, so, uh, so as you hear that, I want you to know that. But let's start with those waiver myths. The first one being, our family makes too much money for the waiver. I hear that a lot. And what that tells me whenever a family tells me that is that they did the logical thing. It's called a Medicaid waiver. You would think you would go to the Medicaid office, but no. And so when they went to that Medicaid office, Medicaid was only looking at whether or not they qualified for Medicaid health insurance, because Medicaid does not consider family income or assets when an individual is approved to start the waiver. Now, if they haven't started the waiver yet, or if the individual's on the waiting list, Medicaid will look at family income and family assets, because they don't have the special income limits of the waiver. And believe it or not, that is the official term, is special income limits. Um, but once the individual has been approved to start waiver services, once they've been targeted, family income is not counted. Now, if the individual who is starting waiver services is married, they will look at spousal income, but there are a lot of special regulations for that, to make sure that the spouse is not forced into poverty, to ensure that their loved one is able to get the care that they need. Um, but even though they don't look at family income and assets, they will always consider the individual's income and the individual's assets, when they are determining whether or not a person qualifies. So, but like I said, there are special income limits that apply, and some resources that aren't countable. So, for example, a person can own a house, and they will not count that against them as long as they're living in it. They can own a vehicle that either they drive or is used for their benefit. That won't be counted against them. And then there are some saving options like special needs trusts and like ABLE accounts that are not counted as assets against the individual. Waiver myth number 2: it takes forever to get the waiver. This is where I'm going to say different waivers have different waiting lists. And while there's a waiting list for some of the waivers, especially something like the family support waiver through the Bureau of Disability Services, it is nothing like it used to be. Believe it or not, once upon a time, the waiting list for a waiver through the Bureau of Disability Services was 15 years long. And thankfully, we are nowhere near that. As of November 2024, the waiting list for the family support waiver is about 2.5 to 3 years long. And there are some priority categories to help somebody get on that waiver sooner. There are now 3 priority categories for the family support waiver: an individual between the ages of 18 and 24 who has finished school, meaning they've gotten their certificate of completion or they've gotten their high school diploma, can request priority status, and they jump to the front of the line. The children of active duty service members or veterans can request priority status. Now, while they do mean children, so even if you are the legal guardian of your brother, that doesn't count. It has to be your child, but it doesn't have to be your child under the age of 18. It can be an adult child who can request that priority status as well. And then the third priority category for the family support waiver just began on July 1st. And that is if we've got someone who is currently on the health and wellness waiver, and they no longer meet the criteria for the health and wellness waiver, but they do meet the criteria for the family support waiver, they can transition over to that family support waiver without going on the waiting list. So those are the 3 priority categories for the family support waiver. So now let's talk about health and wellness and pathways for aging, because we get questions about this on a daily basis. And part of it is Frankly, we're still trying to figure some of this stuff out. And so one of the frustrating things is, people will call us and they'll ask, when am I going to get targeted? How long is the waiting list? There is not actually an answer. The state does not have an answer for that yet, in part because we're still trying to figure out, how quickly things go, and in part because they also have some priority categories, and so they're trying to figure out, on a sustained basis, how long is that likely? How long will that likely last, and how long will it take to get those waivers? So part of it is there's not actually an answer yet. But at the same time, I will say that the state has very recently decided to substantially increase the number of people they are pulling off the waiting list each month. When July 1st occurred, originally the state was pulling 125 people off the waiting list for the health and wellness waiver and 800 people off of the waiting list for the pathways for aging waiver. That has now changed. In October, the state announced that they were going to start pulling 500 people off of the waiting list for the health and wellness waiver each month. And they're going to pull 1,200 people off of the waiting list for the pathways for aging waiver each month. But those waivers also have some priority categories. And so if someone is in an institutional setting, like if they are in a nursing home right now and they want to transition out of that nursing home and go back into the community, go back home, they can request the health and wellness or the pathways for aging waiver, and they jump to the front of the line. If someone is currently admitted to the hospital, they can contact their local area agency on aging and request that priority status, and they can also get that waiver as quickly as possible. And then if somebody is on or is in a program that is 100% state funded, so that's going to be like if we've got a child who is in foster care and they're about to age out of foster care, if we've got a child who has been placed in residential treatment by the Department of Education or by DCS, and they're going to age out. If we have someone who is on choice funding, which you more often see in the aging community, those are 100% state dollars. And so the state will prioritize those people who want to come off of those programs and onto a waiver. Now, I'm going to give an educated guess, and let me be clear. That's all is it is a guess. But based on the number of people who are currently on the waiting list and how many people the state is currently targeting each month, I would say the pathways for waiting or the pathways for aging waiting list is probably in the 8 to 12 month range. And the health and wellness waiver is likely in the 9 to 12-month range. I don't know that for sure. That is totally me guessing, but I do think that it is a reasonable guess based on the way things are happening right now. That may change in the future, but I think that gives a reasonable idea for people. I will also say with the family support waiver, they are targeting people based on their application date, when they submitted that application. But for the health and wellness waiver and for the pathways for aging waiver, they are targeting people based on when they had their in-person level of care assessment. So that's kind of now, there is no waiting list for the CIH waiver because that is an emergency-based waiver, and there is no waiting list for the traumatic brain injury waiver at this time. So those currently do not have waiting lists. The next myth, I'm on the waiting list for the big waiver. There is no waiting list for the big waiver, not anymore. So several years ago, there was a developmental disabilities waiver and an autism waiver. And what they did was they merged those two waivers together to become the Community Integration and Habilitation, or CIH waiver. The thing is, that became an emergency-based waiver. And what they started doing was everybody was getting the family supports waiver instead. So that took us from a 10 or a 15 to a 20-year waiting list down now to we're about at a 2.5 to 3 year waiting list. But there is no waiting list for the big waiver. If you want to learn more about the eligibility criteria for that CIH waiver, we're going to talk about that in a minute. And if you want to talk about your options, you can always with one of our family advocates by calling us at the ARC at 317-977-2375. That brings us to our next myth, which is if you don't have everything you need, apply for the CIH waiver. I hear that all the time. But here's the thing, the CIH waiver is emergency based only. To qualify for the CIH waiver, a person has to meet at least one of the following 6 priority categories: loss of a primary caregiver with no other caregivers available. So if mom dies, but sister is willing to take the person in, that no longer meets that loss of caregiver. And a lot of people assume that that means death of caregiver. It's a little more open than that. So like let's say we have a situation where the parents have to go into a skilled nursing facility. That is also considered loss of caregiver. So that is one option. The next is caregivers over the age of 80 with no other caregivers available. So if mom is 80 but dad is 78, you got to wait 2 more years. And if you're wondering, oh my gosh, why is it 80 years old? Well, that's because that's what the legislature could agree on back when they made these criteria. It was supposed to reduce over time, and it never has. Last legislative session, we were trying, there was legislation introduced to try to reduce that from age 80 to age 65. Unfortunately, that did not pass. That's not something we're giving up on though either, because 80 is a long time. So we're keeping up with that fight. The next one is extraordinary health and safety risk. And they really do mean extraordinary. I have a lot of families who will call me and they'll say, now that school is done, there's nobody to stay with them during the day, so we have to have this. The state doesn't consider that an extraordinary health and safety risk. That's just a regular safety risk as far as the state is concerned. So it doesn't actually meet those criteria. Then we have 3 more that are a little less known. The first is aging out of a childhood placement by either the Department of Child Services or the Department of Education. So again, if we've got a child who's in foster care, or we have a child who's been placed in a residential facility by either DCS or the Department of Education, and they are aging out, it's not that they just don't need it anymore, it's that they are aging out, they can request the CIH waiver. Anyone leaving an institutional placement like a skilled nursing facility or a group home, because a group home is considered an intermediate care facility for the developmentally disabled, making it an institutional setting. So a lot of times the BEADS office will tell people you can go into a group home for at least 90 days and then you can request to leave with a CIH waiver. I have seen that happen many, many times. I have also seen some examples where that hasn't happened. It's certainly something that you can explore, but it's something you want to take a lot of time and really consider to make sure that it is the right choice for your loved one. And then the final category for the CIH waiver is substantiated cases of abuse, neglect, or exploitation. Because if someone is not safe, by golly, we want to make sure that they are. So those are actually the criteria that you have to meet to get the CIH waiver. And I will also say it is taking a very long time for them to consider CIH applications. It is taking several months. I know of some cases where it's been nearly a year while they are considering a CIH application. So if you have applied and you haven't heard anything, that's happening a lot. And it is incredibly difficult at this point in time to get that CIH waiver. So next waiver myth. You cannot live on your own or you cannot move out of your family home without a CIH waiver. Well, maybe. This is where I'm going to say it really depends on the individual and what their needs are and what their skills are and how much support they need and what other resources they may be using. So not all supports have to come through the waiver. You can try to use home health aides that Medicaid pays for. You can use some community resources, especially when it comes to transportation. You can also um, set up, just some of those natural supports where, maybe you're carpooling with someone to work, or you're going out with somebody once a week to go do your shopping, or maybe you're using some technology to help. So there are a lot of different resources that may be able to help somebody live on their own, even if they don't have that CIH waiver. And so this is really a time where you can use those life course framework tools, and especially those integrated support stars, to figure out what resources do you actually have available to you. What are your loved ones' actual needs versus what are they able to do? What are the skills you can continue to work on to get them to that point where they may be able to live on their own? And then especially what technology is available to make everyone a whole lot more comfortable with that. Maybe you're FaceTiming, maybe you set up a Ring doorbell so that you can see who comes to their home, and things like that, as just an extra layer of security. But there are a lot of different options that may be available, but it really depends on the individual. But it can be possible for you to live on your own, even with the family support waiver. Next myth, and then this is one that frankly is one of my pet peeves. You must obey your waiver staff. They direct your care and they can tell you what you can and cannot do. Nonsense! Your waiver staff work for you. You hired them and you can fire them. Your waiver staff has to follow your person-centered individualized support plan. Okay. But if you don't like what's happening, you can request a team meeting. You can talk with your case manager to talk about your preferences and possibly revise your plan. But sometimes it's also a matter of it's just not a good fit with a specific direct support professional, or DSP, a specific staff member. So you can also always talk with your waiver provider about getting a different staff person in there. And if they don't have someone, or you don't get the response you like, you can always change waiver providers, because again, your waiver staff work for you. They should not be telling you what to do. They're there to help you live the life you want to live. And as you can tell, I'm a little heated on that one. So let's stop for a minute and ask, what are some of the waiver questions you have, or potential myths you think you have heard? So go ahead and type those out in the Q&A, and let's answer some of those. Does the hospital admittance have to be a certain length for the priority placement for the waiver? Can a person go inpatient for just a few days and then get priority status? That is an excellent question. And what we have been told is that it's just a matter of they have to actually be admitted. So just going to the ER isn't enough. Having an outpatient procedure isn't enough. They have to actually be admitted to the hospital. But from what we have been told by the state, even if it's just a few days, that absolutely should qualify for that. Now, does that mean if you're in the hospital for like 3 or 4 days, will they necessarily have everything in place by then? Probably not. But as long as the local area agency on aging has updated the computer system to say that you are in the hospital, when you leave, you contact them again to say, hey, I've been released. Now I need to start that health and wellness waiver. I say that is the way things are supposed to happen. And I say it that way because this is brand new. And this is a situation where it's a pretty major shift from what has been done in the past. So everybody's still trying to figure out how this is supposed to work. Um, Again, that's how it's supposed to work, is you call them up, you let them know the person is in the hospital, you get them to change in the computer system that they are currently hospitalized. And when they leave, you contact them again to say, hey, we've left, we need to start that health and wellness waiver. Um, but I think right now it's going to take a little bit of time, realistically, before everybody knows how to do all of that. Um, so then the next question, would violence towards caregivers be considered unsafe or abuse? It can. I have also seen many situations where even in an abusive situation where it is the individual with a disability who's being abusive, that it doesn't necessarily that they don't necessarily give the CIH waiver for that. And that's not something that I can really defend. But I have seen situations where it has happened. I have seen situations where it has not happened. And so I think part of it kind of depends on the level of violence and things like that. And sometimes we have individuals where their level of violence, frankly, is so high that it may not be safe for them to have a waiver. They really may need more of a group home setting or more of an what's called an ESN or extensive support needs group home setting to help address that violence first. So that is a great question, and I know it feels like I totally dodged it. Um, but that's because, like in a lot of the situations we're going to have soon, the answer really depends on the individual situation. So, all right. Let's keep going. Let's talk about those transition myths, because there are a lot of those out there too. And the first transition myth is that you must get guardianship when your child turns 18. Everybody tells you that. The only thing you ever hear about is guardianship. The doctors tell you need to get guardianship. The teachers tell you need to get guardianship. It's what everybody says. Nonsense. There are a lot of support options beyond just guardianship. Now, there are times where guardianship is necessary, and I don't dispute that. But guardianship is the most restrictive option that there is, and it really does prevent independence. And so, guardianship so often has always been the first resort. That's the only thing we've ever been told as our kids have gotten older, but it really should be a last resort. We should try all other options first. And options include things like supported decision making, power of attorney, healthcare representative. There are a lot of different options out there. And there are also a lot of tools to help figure out how much support your loved one actually needs and how that may change over time. We may have a situation where they don't need guardianship right now, but maybe as they're getting older, they may. Or we can always start with something less restrictive, like supported decision making or like power of attorney. And if it turns out not to be enough later, we can always go for guardianship later. But it is very difficult in Indiana to start with guardianship and then terminate that guardianship. It is actually possible, but the very first case of a person with an intellectual or developmental disability who had their guardianship terminated was a woman named Jamie Beck in 2018. That hasn't been that long ago. It's only been 6 years since the very first person in the history of the state of Indiana with an intellectual or developmental disability had their guardianship terminated. So we can always start with something less restrictive. And if we need something more later, we can go for it. But it's very difficult to do the reverse. And of course, again, you can always call our family advocates and have that discussion and really kind of get into the nitty gritty of your situation to help you figure out how much support your loved one actually needs. Next transition myth. The school can't talk to you once your child turns 18 unless you have guardianship. Oh, there are a lot of us who have heard that one. And again, nonsense. You do not have to have guardianship to continue to talk with the school, but schools do have to follow the Family Educational Rights and Privacy Act, or FERPA, which is a federal law designed to help protect an individual's education information. So think of FERPA as the school version of HIPAA. Okay. So schools can talk to you, but they need your students' permission to do so. And there are a lot of different ways to do that. So support options like power of attorney and supported decision making can absolutely address educational matters to allow you to still talk with the school. But in all honesty, it can be as simple as your student simply telling the teacher, "Hey, I want you to still talk to my mom." Now, I am a person who I want things in writing because without it being in writing, there is no way to enforce it. So what I recommend is a student can simply send an email to their teachers, to their counselor, to the principal to say, "Hey, I want my parents to still be included in all of my education matters. And the schools have to honor it. It's not an optional thing. If a student says, "I want you to talk to my mom and dad," they have to talk to mom and dad. Now, that also means your student can say, "Hey, I don't want you to talk to them anymore." So you do have to keep that in mind. But no, you do not have to have guardianship for the school to talk with you. Next transition myth. If you have an IEP or the waiver, you'll automatically qualify for SSI and food stamps. Oh, if only it were that simple. So, our loved ones are involved in a lot of different programs, whether it's Medicaid, the waivers, Social Security, food stamps, housing subsidies, all sorts of different programs. And while they tend to be interconnected and while they overlap, each one of those programs all have different eligibility guidelines. So if a person qualifies for SSI, because Indiana changed the law back in 2014, if you qualify for SSI, now you will automatically qualify for Medicaid health coverage and for food stamps. And that's because the state of Indiana will actually defer to the Social Security Administration's decision on that. And if you qualify for SSI, that is also a financial based program. So that shows you will automatically financially qualify for Medicaid and for food stamps. But you still have to fill out a separate application for each of those programs, even though you will automatically qualify. But one of the biggest myths is that if you have an IEP or you've got a waiver, that you're automatically going to qualify for SSI, because of course you're disabled. Social Security's definition on disability is very, very different from that. Social Security's definition on disability is looking exclusively at your ability to work, or more importantly, your perceived ability to work. And in fact, that was actually our webinar last month on navigating that SSI process. You can watch that on our YouTube channel so that if you need more information on that. But just because you've got an IEP or the waiver does not mean you will automatically qualify for other programs. Another transition myth. You can't get Medicaid if you live at home. So this comes from the fact that, believe it or not, here in Indiana, we have 37 different types of Medicaid. I kid you not. And while there are some overarching rules when it comes to Medicaid, each one of those 37 categories have their own exceptions and their own twists and turns and their own special caveats. And that's why it can be so frustrating when you talk to the Medicaid office and you get an answer every time you talk to them. Well, it's because different categories have different answers. And the reason there are a lot of people who think you cannot get Medicaid if you live at home is because there are many types of Medicaid that adhere to what are called modified adjusted gross income, or MAGI rules. Those MAGI rules were passed around 2010-ish, and they were designed to crack down on Medicaid fraud. And so what those rules say is that they will look at the income of everybody living together in the same home, even if they're not legally related. So for example, when you have a family, mom, dad, and the kids, but mom and dad aren't married, that no longer matters because they're still going to look at both mom and dad's income to see if that family qualifies for Medicaid. Now, there are also some exceptions to that. So, for example, if you are just living with a roommate and you guys are just roommates, think about, those kids who are in college, living with housemates or whatever. You've got to do some documentation on that, but there are ways to make sure that your roommate who you're just sharing a living space with is not counted against you. If you are living in a boarding house, for example, and just renting a room, there are ways to do that. It's just a matter of that documentation. But here's the thing: individuals who have waivers have a type of Medicaid, they have a category of Medicaid that does not follow MAGI rules. And part of the confusion comes in with, there are so many categories that do follow those MAGI rules that the Medicaid office may inadvertently give inaccurate information because they're used to what they deal with most of the time. And I like to joke that our loved ones are the purple sparkly unicorns of the world because they qualify for all of these programs and break a lot of the regular rules in the process. If you have a waiver, Medicaid will not look at household income unless the individual with the waiver is married. And then they will, but there are some special regulations with that as well. The next transition myth, you cannot get SSI if you have a diploma. Of course you can. Social Security's decision, while they do consider education, what they're really looking at is a person's perceived ability to work and engage in substantial, gainful activity. That's the amount of money Social Security believes a person should be able to make after they subtract things like work incentives, job accommodations, and employer subsidies. So it's while people tend to act as if that substantial gainful activity amount is just a flat out, clear cut answer, in 2004 or in 2024, that has been 1550 per month. In 2025, that'll go up to 1620 a month. But that's in countable income because there are a lot of ways you can reduce how much money Social Security actually accounts. But yes, you can absolutely get Social Security. Even if you have a high school diploma, there are people with college degrees who are on SSI. It really depends on the individual situation. You cannot vote if you are under guardianship. In Indiana, you sure can. Now, this is very state dependent because there are absolutely states where if you are under guardianship or if you are under conservatorship, you are not allowed to vote. In Indiana, you retain the right to vote even when you are placed under guardianship. In fact, most people with disabilities are often some of the most engaged, well-informed voters in the community. But yes, you can absolutely vote even when you are under guardianship in Indiana. So now I want to take a moment and ask, what are some of those other transition myths you guys have heard? Um, oh, somebody is asking, when it comes to whether or not the school can talk with the parents, is that also true with college or just high school? Well, here's the thing. Colleges won't talk to any parents, and, unless they have a very specific signed consent to do so. Because when you're in college, typically speaking, you are an adult, and colleges really do want to cut the apron strings on that. They really want their students to embrace being adults. Can your child give you permission or give the college permission to talk to you? They can. I think it tends to be frowned upon though. So it is possible. And more importantly, when you've got a child or when you have a loved one who is going to college, and this is hard, and I say that because my youngest son right now is a senior in high school and is looking at colleges. He doesn't have disabilities. He does have mental health needs, but he doesn't have an intellectual or developmental disability. Is it hard for me not to take charge? Oh my gosh, it is. But I know that that is not in his best interest. It's just really, really hard. It's, you know, especially if we do have loved ones who are attempting college and all that, part of that is how to enforce that independence and reinforce what it means to be an adult. Like I said, man, is that hard. But that is also what is in their best interest. And so in part, creating a plan on how to do that is really, really important so that they can continue to learn and to grow in their adulting experiences. And that's true for all transition age kids, whether they have disabilities or not. It's hard for all of us. And so that's just something else to keep in mind. Somebody else has a question about food stamps. Um, my boys make $30 more than what two people get in EBT. You know, And here's the thing, and again, this is where it gets really, really frustrating and why there are so many myths out there, because it's not a straight answer with food stamps. Like you can't just say, oh, if you make $1,000 a month, you get $55 in food stamps. It's not that clear cut. They use an algorithm, they use a formula, and they look at all of your expenses as well as your income to determine how much you get in food stamps. So one of the things I would do is I would make sure that the food stamps office actually has accurate and up-to-date information. I would look over their worksheet that they have to determine how much a person should get in food stamps. Let's make sure that that information is correct. Let's make sure they're not accidentally counting something twice, because I've seen that happen before. So really, it's about making sure that they have accurate, up-to-date information to make sure that you can maximize the amount of food stamps that you can receive. I will also say that that when it comes to food stamps, they will look at everybody in the household's income, unless you have provided some documentation saying, hey, this individual, they buy their own food. We do not make food together. Everything is kept separate. That way, they're not looking at everyone else in the household, because otherwise they will. So keep asking questions and keep putting those in the chat while we go to the next section, which is on employment, because there are a lot of employment myths too. The biggest one being you cannot work if you get SSI, SSDI, Medicaid, or the waiver. Nonsense. And part of the problem with this, and one of the things that gets me upset is, you know, when talking about SSI and SSDI, Social Security is the one who says, "Oh, you can only get these programs if you can't work." But that's not actually what they mean. It's what they say, but it's not what they mean, because they define working as engaging in substantial gainful activity. So yes, you can work and have these programs. With SSI and SSDI, it's that you can't engage in substantial gainful activity, but you can actually work. It's a matter of how much you're working. Same with Medicaid, same with the waiver. Um, so some of the things you can do is, especially with Social Security, is documenting what type of work incentives your loved one is using. And that's going to be person specific. They're looking at things like impairment related work expenses. So, for example, if your loved one takes door to door bus transportation, to get to and from work. So, like, I live in Hamilton County. My son uses Hamilton County Express most of the time to get to and from work. They can subtract how much he spends on Hamilton County Express from his countable income. But sometimes Hamilton County Express doesn't have a ride for him, and that happens. That's okay. And he'll use Lyft to be able to get him to and from work. They will subtract the cost of the Lyft to get to and from work. Um, Things like prescription copays, because if they don't take their meds, they're not going to be able to work. So those prescription copays, if they are the ones paying it, that would be an impairment related work expense. But then there are also things like employer subsidies. So if your employer is allowing you to work fewer hours, or have reduced job duties, um, or or um, or they recognize that you work slower than a typical employee would, or an employee without a disability would, but they know you, they love you, they know you do great work. It just takes you longer to do something. That's called a production level. And Social Security will use that information to reduce how much of your income they're actually counting. Now, most families have no idea how to document that. So that's where I would say talk with a benefits specialist, either through Voc Rehab, through Indiana Works WIPA if you are in northern or central Indiana, or through SERS if you're in southern Indiana, to talk about your specific situation. If you have a waiver provider who has, they're called BIN officers, Benefit Information Network, or people who have been been trained, you can talk with them to help figure out what work incentives you're actually using so that you know how to document them. There are also ways that you can document your waiver services, even though you aren't paying for those directly. You can also document the supports you need on a work activity report, to document the amount of support you need in order to make sure that you can work and that you can maintain your work. Okay. Uh, but here's the thing. A lot of people are afraid, especially if they're on SSI, that if you work, you'll lose your SSI. It's not that you'll lose your SSI, and your SSI check may be reduced if you work, but the money you make from your job will make up for that. You will always bring home more money when you work than if you don't work. Okay, so there may be an impact on an SSI check, but you will still be money ahead because the income you get from your actual employment, your actual job, will offset any reductions in your SSI. As for Medicaid, we've got a few options there. First of all, when you have a waiver, you've got higher income limits in the first place. But there's also a special category of Medicaid called MedWorks, and that is specifically for individuals with disabilities who are working. You can make up to 350% of the poverty level, and qualify for MedWorks. What that means is now in 2024, you can make $52,700 a year from all sources. So between your Social Security and your employment income, you can make $52,700 a year and have full Medicaid. Now, poverty levels come out toward the end of January, so I don't know what they will be for 2025 yet. We won't know that until closer to February. But you can absolutely work and still keep your benefits. And that category of MedWorks is waiver compatible. So you can be on MedWorks and keep your waiver. There's also a version of MedWorks called MedWorks Improved. And that is designed for people who have worked off of Social Security benefits, but they still need those Medicaid health coverage benefits so that they are able to continue to be healthy and to work and all that. And that is also waiver compatible. Another employment myth: you can only work in a sheltered workshop. If you're not sure what a sheltered workshop is, that is often a facility, and oftentimes it is manufacturing work, although not always, but it's where they pay sub-minimum wage. You make less than minimum wage when you work there. People with disabilities are not limited to working in sheltered workshops, making sub-minimum wage. You can absolutely work in competitive wage, community-based employment. You can even own your own business, and there are a lot of programs and work incentives to help make that happen. You can talk with vocational rehabilitation services, a benefit specialist, or a family advocate here at the ARC to learn more about that. If you have a loved one who is in a sheltered workshop and they're talking about, what to do next, because now with waiver changes in last July, an individual will only be able to have 18 months of pre-vocational training, which is often what sheltered workshops are billed through. So there's going to be a limit to that, and the feds are the Fed's current plan is to end workshops by 2027. Many of the sheltered workshops here in Indiana have already transitioned away from sheltered work, or from sub-minimum wage, more appropriately. They have switched to competitive wage jobs, community-based jobs. They've done everything from opening coffee shops and opening popcorn stores, to buying shredder trucks and providing community shredding services, to all sorts of different things. And so if you are somebody who has a loved one who is still working for sub-minimum wage in a sheltered workshop, go ahead and have that conversation with them. Most of the ones who are still open are absolutely working on implementing a transition plan right now. So have those conversations about what supports would be available for your loved one going forward. Another myth: you can only work a few hours per week. Oftentimes people get told, oh, you can only work part-time, you can't work more than 20 hours. Depends on the individual. And that's the thing. Everybody wants to know how many hours they can work. There's not a clear-cut answer for that because it really does depend on each person, because it depends on what types of work incentives they have available to them. And it also depends on which program we're talking about, because Social Security, Medicaid, regular Medicaid, um, waivers, Medicaid, when you have waivers, and MedWorks all have different income limits. So how much you can earn really depends on the specific situation. Um, and especially looking at those work incentives, those job accommodations, those employer subsidies, to help figure out how much you are able to work per week. And again, you can talk with one of our family advocates. You can talk with a benefits specialist to be able to help you figure those things out and figure out how to document all of those. Because the reality is, documentation is key. Making sure you've got the appropriate paperwork is extremely important in all of this. You can only make minimum wage or near minimum wage. Nope. Again, you can actually make much more than that. And most jobs nowadays, even entry level jobs, are paying higher than minimum wage. And so really it's about looking at what types of employment supports are available for you. Also, we do have some individuals who are interested in working themselves off of Social Security benefits. Okay. If they want to do that, they can still have MedWorks, because again, we've also got that MedWorks improved category for people who have worked off of Social Security benefits, and that would allow them to keep their Medicaid and keep their waiver. Um, but you want to make sure that you develop a plan on how to work off benefits so that you're not facing a cliff, so that by the time you are ready to work off of those benefits, you are used to no longer using those benefits and having those benefits available to you so that you can make that transition a lot easier. I will also say, especially with Social Security, they also have a 5-year period for what they call expedited reinstatement. So if someone lost their Social Security benefits and within 5 years, or especially if they have worked enough that they have worked off of those benefits, but maybe they wind up having a health setback and they need to restart those benefits. If it happens within 5 years, there's something called expedited reinstatement that can try to fast track that. Okay. Um, so now let's come up and look at other employment myths. What employment questions do you guys have? And right now, I do not see any. So go ahead. I'm gonna wait a few minutes to let people put any of their employment questions into the chat, or into the Q&A, excuse me. And at this point, I believe the next slide is to ask, are there any other questions you have, or any other things you think may be myths, or any myths you've heard and you want some clarification on? Let's just go ahead and open it up and ask anything right now. The only problem is I can't see if anybody's typing. So here's the thing. If you are anything like me, oh, somebody did put one in there, I think. Can you explain how the benefits can be worked off of? I understand the 5-year rollback in, but how does one not use their benefits? So, for example, if you have someone whose goal is to work off of Social Security benefits, one of the things they can do, and let's say, for example, they get $1,000 a month in SSDI. Well, one of the things they can do is they can start slowly putting money from each paycheck into like a special needs trust or an ABLE account until they get to the point where they're putting that entire $1,000 into that special needs trust or into that ABLE account each month. And they're used to not living off of those Social Security benefits. I've got a friend right now who's actually, it's not that she wants to work off of her Social Security benefits, it says she's thinking about retirement. And so one of the things we are working on is getting her ready so that when she does retire, she's not used to living off of that employment income too. So every paycheck, she puts money into her trust and she keeps increasing it every few months so that she can get to the point where she's no longer used to using her employment income, and she is used to just living off of her social security benefits, so that when she's ready to retire she can actually do that. And so it's that type of planning. And if we have someone who wants to say work off of their waiver benefits, well, a big part of that is making sure that they are, learning the skills necessary so that and putting some additional supports in place so that maybe they can be able to live on their own without having those waiver benefits. And there are some people who can do that. So it's really about making a very methodical plan. And this is where it's really helpful to work with their waiver team, with their VR team, to help map out how to do that, so that people are actually ready for that. Um, Somebody asked, how do you sign up for MedWorks? I have a snarky answer, not a good answer to that. Um, because what Medicaid will tell you is it's all the exact same process. There's nothing you have to do differently. That's how it's supposed to work. Um, in real life, it's a little bit more of a challenge, in large part because MedWorks does charge a monthly premium based on a person's income. So MedWorks is switching to MedWorks is seen as an adverse action because regular Medicaid is free and MedWorks charges a premium. So it gets a little tricky. That is a time where I would actually probably go into the Medicaid office and try to talk to somebody who actually knows about MedWorks. And I'll be perfectly honest, most people have never even heard of MedWorks, even in the Medicaid office. My snarky answer is when you get the notice saying that your Medicaid is going to be terminated, you give me a call and I send you the appeal letter saying, hey, switch me to MedWorks. But again, that's my snarky answer to that. Um, so it's more a matter of because MedWorks is seen as an adverse action because they charge a monthly premium, it's a little bit harder to do. But the hardest part about it is finding somebody in the Medicaid office who actually knows MedWorks exists. And MedWorks is one of those programs that can offer so many benefits. Like you can have retirement savings if you have MedWorks, and they won't count it against you. But there are very, very few people who use MedWorks, and so it's not a program that is well known. So, um, how do you get legal help for an adult who has FASD? That's fetal alcohol spectrum disorder. It's going to depend on the type of legal help you're needing. Anytime anybody needs criminal justice help, that always has to go through either a private criminal justice attorney or a public defender. While there are pro bono attorneys out there, they do not take criminal justice cases because the public defenders are a program, because the public defenders exist, and that is their responsibility. So if we're talking the criminal justice system, it's got to be through the public defenders. If we're talking other types of legal help, first of all, you can always hire an attorney, especially when it comes to Social Security. There are a lot of Social Security attorneys. What I would say is if we're talking about somebody with an intellectual or a developmental disability, because most Social Security attorneys have only been taking those kind of cases for the last 5, 6 years, there aren't as many Social Security attorneys who understand intellectual and developmental disabilities. They often took cases where somebody was physically hurt on the job or somebody had mental illness. So if you find a Social Security attorney who understands mental illness, there's there's enough overlap there in the Social Security world that would be somebody who would do a decent job of representing somebody in a Social Security case. And Social Security attorneys only get paid when they win. And they get a percentage of any back payment that the individual receives. So you do not have to pay a Social Security attorney up front. Beyond that, like let's say we've got some housing issues or we've got guardianship issues or things like that. There are some pro bono attorney organizations out there, Indiana Legal Services being one of the biggest. Um, Neighborhood Christian Legal Clinic is another. Um, a lot of the law schools will have legal clinics that they run, but oftentimes there are limited time frames just because they're going along with the school calendar, and they can represent people in certain situations, especially things like housing um, or or um, or even some domestic violence issues, believe it or not. And then Indiana Disability Rights is a state agency whose purpose is to protect the rights of people with disabilities. So especially when we're dealing with an issue where someone's rights are being violated, Indiana Disability Rights may also be willing to represent that individual. I will say with the pro bono offices and with the Indiana Disability Rights, they cannot take what are called fee generating cases. You can't sue somebody and expect to get money and have a pro bono attorney represent you, in large part um, because other attorneys will represent you on what's called contingency, oftentimes where they will represent you and they get paid if they win. So there are a lot of different answers to that. So it really kind of depends on what type of legal help that individual needs to know which path to send you down. Okay. Will there ever be a webinar regarding guardianship and other options, or who can I contact at the ARC for more in-depth information? I swear I did not plant that question, but I love you for asking it. So first of all, you could always call and talk with one of our family advocates, and that's literally just a matter of calling us at 317-977-2375. And asking to talk to one of our family advocates, and we can tailor that information, based on your particular situation. But we do have webinars on guardianship and alternatives to guardianship. In fact, you can either find them on our YouTube channel, or we also have something called the ARC Academy, which is a free online self-paced training platform where you can learn about all sorts of disability related issues. And I've got an entire training module on guardianship and alternatives to guardianship. The website for that is advocacy.thearcacademy.org. And I have everything on there from where we go through all of the different options on guardianship and alternatives to guardianship. I've got webinars on dignity of risk. And as a parent of a young adult and now two young adults, I will say as a parent, sometimes it's scary, and I remind myself every parent feels like that. I've got a webinar on how do you do supported decision making. So we've got a lot of different resources on the ARC Academy for that too. By all means, check it out. You can watch them at 11 o'clock at night when you actually have time. So, and of course, give us a call here at the ARC because that's what we're here for. Um, oh, uh, someone, someone who was asking about the criminal justice question or talking about attorneys earlier, and we talked about the criminal justice system a little bit. The Arc of the United States also has a national center on criminal justice, they've got a program called Pathways to Justice. They've got a lot of resources on the Arc of the United States' website on that. And again, you can always call us here at the state office and talk things through. Um, FASD United also has a lot of information on the criminal justice system, especially as it pertains to individuals with fetal alcohol spectrum disorder. FASD United is a fabulous resource if you have a loved one who is affected by FASD, or if you suspect that, and talking with them to figure out, is this something that could be an issue with my loved one? And the person is asking for the phone number one more time. And so let me say it is right here. It is 317-977-2375 or 1-800-382-9100. I am so sorry, guys. I see that a couple of people have their hands raised. I don't have a way to allow people to unmute. So if you are able to put your questions in the Q&A, that would be really helpful. I just want to give it a moment so that they can try to add their questions in there if they can. All right. Well, ladies and gentlemen, thank you so much for joining us this evening. I hope that this was helpful. Like I said, if you're anything like me, you're going to think of a new question like 3 weeks from now. Give us a call. And part of it, especially when because we're talking about myths and we're talking about misinformation. The thing we can't ignore is that sometimes it's not intentional misinformation. It's just that it's old information that hasn't been updated. And there have been so many changes in the last year, and there are more changes to come. So all of these issues will be evolving and they will be changing. So one thing I also want to recommend is consider signing up for the ARC's e-newsletter or for our legislative action alerts. You can do that through our website. The e-newsletter, we only send it out once a week. We send it out Sunday evenings. So we're not going to, slam you with a bunch of spam. We send out an update like once a week. With the legislative session, we also send that out once a week, normally Friday afternoons, to give people an idea of what is going on with the state legislature. There are going to be a lot of issues that come up in the next General Assembly session, the next legislative session. So you really do want to make sure that you are staying up to date and so you know what's going on so that you can respond to all of that. Somebody else is asking, do you know of any communities in Indiana for those with developmental disabilities that are fairly independent? Looking for any that have activities. Yes. And so we're seeing more and more of those crop up all across the state. Sometimes they're called pocket communities. And I'll be honest, they're kind of controversial. Um, some people love them, some people hate them, and some are really good and some not as great. Um, the idea is people, with disabilities, living together, maybe in the same apartment complex or the same subdivision or something like that. Um, and I'll be completely honest, one of the big concerns is that sometimes it's not the most integrated setting. And I recognize that for a lot of families, it's, they feel more comfortable with that because they know that there are people around who are keeping an eye out on people and watching over people, and they're thinking about the safety factor of it. But the other side of that coin is that sometimes they become very segregated communities and they are isolated from the general public. So one of the things you're going to see more of, while there are definitely pocket communities that are developing, one of the things you're going to see more of is some more integrated communities where there is a very intentional effort to make sure people with intellectual and developmental disabilities can live there. So for example, the federal government for the last few years has been providing grants for developers and for apartment complexes where they agree to set aside 20% of their units specifically for people with intellectual and developmental disabilities. And in doing so, they're making sure that it is still integrated, that people with disabilities aren't being segregated, but it's very intentional where there tends to be where it does allow more independence, but there's also tend to be somebody on site that they can go to when they need some help. There are several all across the state and more that are growing. Um, several in the Indianapolis area, some in northern Indiana. One of the things you want to look for when you're looking at these communities is you want to make sure, first of all, you want to look at price, because I have seen some where they are selling you a condo type condo type idea for about $250,000, and you have to pay about $500 a month in fees to pay for the person who the community person who lives there. Not very many people can afford that. I have also seen a lot more recently where, again, they are those apartment complexes that are open to the general public, but 20% of the units are set aside specifically for people with disabilities, and often with subsidized rent. There are some communities being developed where they're building houses or even tiny homes along with all of them. And then I've also seen some where they have built a bunch of houses together and then they have built doors within them, almost like an adjoining hotel room, so that the staff can go in and out. I'm not as big of a fan of that. That actually causes me a lot of concern. But there are several that are being developed. You want to do your due diligence, and you want to look into them, pretty substantially, to figure out, what works, because you're right, especially when you have somebody who is fairly independent. We want them to be able to live as independently as possible. And that might mean just, living in a regular apartment complex, or maybe a gated apartment complex, but then we're also using things like, FaceTime and Ring doorbells, and we're using remote supports through their waiver as opposed to, in-person supports, so that when they need help, there's somebody who's answering them, but that doesn't necessarily mean that they have to have someone with them at all times either. So there are a few different options for that. Um, is there an Ask the Arc next month? You know what? I'm very glad you asked that, because typically we take December off just because December gets incredibly busy. There are so many different things you have to do, whether it's you're going somewhere and having fun and going to parties, or whether you're doing, school activities or whatever. We do tend to take the month of December off, but we will be back in January. And then, what about communities like for people with physical disabilities, like people with quadriplegia? Um, Again, a lot of times, especially when you have someone who has quadriplegia, they need a whole lot more hands-on support, and so that's really where assisted living comes in. And assisted living, believe it or not, is actually a waiver service on the health and wellness waiver, the Pathways for Aging waiver, and on the traumatic brain injury waiver. So oftentimes, especially when you have someone who has pretty substantial physical disabilities, um, that may be where you go. And assisted living is not considered an institutional setting. Um, so that is one option. But if you just have, physical disabilities, maybe you're a wheelchair user, but you're still fairly independent. Again, all of those apartment complex options would be available to you. I will also say that when it comes to housing, there are certain requirements under the Fair Housing Act, which is a federal civil rights law, when it comes to things like reasonable accommodations for housing, and what the requirements are to make sure that housing is accessible, and things like that. And the Fair Housing Coalition of Central Indiana has some really, really good webinars that you could find on YouTube, specifically about that. They've got some great resources on their website about fair housing and disability, and what rights you have when it comes to housing. So that's the Fair Housing Coalition of Central Indiana. And they've got some, and fhcci.org, I believe, is their website. So they've got some really great things too. All right. Well, ladies and gentlemen, thank you so much for joining us tonight. I hope this information was helpful. If you've got more questions, by all means, give us a call. We would love to talk with you, and have a wonderful evening. Thank you so much for joining us. Good night, everyone.